This is forward?
Yeah.
Backwards?
Backward. Yeah.
Imagine you want to point something,
Ah, okay. Okay. Wonderful.
but please,
Uh-huh.
please don't press this one because you black out the screen.
Ah, okay. Okay.
So it will
I
be
have to
black.
be
I will
careful.
have to run to the
Okay.
stage.
Sure.
and-
Sure.
yeah.
Well noted.
You're going to use the podium, yeah?
I think that's to
You're
Dr.
using the podium?
Yes, I will use the podium. Yeah. Thanks so much. Yeah. Mikhail, I don't have his WhatsApp. But I can also use this mic. I can walk around. Yeah. Yeah. Okay, wonderful. Yeah. Thank you. Okay. Yeah. Wonderful. Thank you so much.
One, two.
Ah, okay. for event on health, addressing the health impact of climate change on the vulnerable segment of the society, particularly focusing on migrants and mobile population in the MENA region. My name is Masako Ueda. I'm the Regional Migration Environment Climate Change Specialist of International Organization for Migration, IOM, Regional Office for Middle East and North Africa. It's our great pleasure to jointly organize this important side event with the World Health Organization, WHO, Regional Office for the Eastern Mediterranean, as well as in close coordination and great support from the UNFCCC colleagues. The interlinkage between health and climate change is well established within UNFCCC processes. The convention itself recognizes and highlights health as one of the three categories of the adverse effect of the climate change, along with ecosystems and socio-economic systems. Also, there is a growing recognition of human mobility linked to the climate change, particularly in relation to the loss and damage and also adaptation work streams. Human mobility, including displacement, is recognized as one form of non-economic losses. Concurrently, migration can be an effective adaptation strategy if it takes place in a safe, orderly, and regular manner. By enabling people in a climate and hazard-prone areas to move to safer locations and pursue their lives with dignity. The Paris Agreement request request the parties to respect the right to health as well as the rights of migrants. The climate change affects everyone, but its impact on the individual is unequally distributed. Migrants and other mobile population face greater exposure to health risks of climate change because of their pre-existing vulnerabilities linked to their mobility patterns and status, as well as the specific working condition in the destination countries. The nexus between climate change, health, and human mobility require further discussions and attention in the climate change discussions. I am, together with WHO and other partners, is spearheading this discussion and promoting the better understanding of the nexus. So today's session is one of such platforms to have a discussion and explore this nexus.
En ce qui concerne les problèmes de santé et ses influences sur les impacts sur la société et surtout sur les migrants. Et les populations mobiles à cause de crises et catastrophes. Dans cette séance, on va se concentrer sur les initiatives et les politiques et les pratiques dans cette région et aussi va discuter les effets et les solutions. Cette séance comprend deux sujets. Premièrement, les offres et les demandes et aussi les décisions à prendre par rapport aux techniques écologiques. Alors moi, je vais commencer par la première partie. On va mettre en accent le message de M. Othman et le directeur régional de Moyen-Orient et en Afrique du Nord, qui était un membre de l'IM en 2003 et après, il a occupé plusieurs postes dans cette région. Et aussi, il était un conseiller au Nord d'Afrique et au Moyen-Orient aussi, et en Genève. Il y a une offre, il y a une présentation de M. Othman. Assalamu alaikum wa rahmatullahi wa barakatuh. Premièrement, je m'excuse pour ne pas être avec vous ici dans cet atelier et parce que j'ai des préoccupations en ce moment. Merci pour cet atelier, surtout qui est à Riyad, le cœur d'Arabie Saoudite, sur les problèmes de santé, surtout pour cette séance, surtout où la santé, ou les problèmes de santé qui impactent cette région. Et comme vous saviez, que cette région a été impactée par la température. Et c'est concrètement qui influence tous les secteurs autour. Et aussi, comme on a un problème de climat, aussi on a un problème de santé qui diffère entre des pays aux autres. Et aussi la puissance et l'évaluation et le bâtiment. Et quand les gens se déplacent à cause du climat, il faut qu'on accepte ou ne pas soit on accepte ou ne pas accepter. Il faut qu'on change ces ressources. Et on pense qu'il y aura 10 milliards de gens qui influencent dans les zones de Nord d'Afrique et Sud d'Afrique à cause de ce changement climatique, nos fils. Alors, ces populations non virables étaient très influencées par tous ces changements climatiques et aussi l'influence de ce changement sur l'impact sur la santé, sur l'augmentation de migrants et peut être aussi influencé par les défis sanitaires, surtout les gens qui se déplacent d'autres zones à zone, qui se trouvent dans une zone très différente par rapport au climat. Et alors, surtout ce qui concerne la santé, en ce qui concerne aussi les maladies respiratoires, ce qu'on voit, entre les migrants et aussi la santé, les santé humaines. Et c'est notre préoccupation dans cette région pour garantir la durabilité de santé et le bien-être, qui sont des objectifs durables pour la croissance mondiale. Il faut qu'on y arrive à réaliser tout ça au niveau mondial. Et aussi, il y a une convention internationale qui demande la coopération dans le secteur de santé au niveau politique et international. Et aussi, comme nous sommes les premiers pays, nous devons mettre l'accent pour trouver des solutions pour confronter ces crises et aussi pour augmenter notre bien-être et notre santé. L'organisation des migrants se concentre bien sur cette région et veut améliorer cette coopération pour aider ces populations. Nous avons réalisé un atelier à Koweït pour augmenter ou pour relier les relations de santé et migrants au niveau mondial. Le résultat de cet atelier, les gouvernements dans le secteur public et gouvernemental doivent discuter ces problèmes et aussi pour présenter des recommandations pour traiter ou pour répondre à ces questions pour qu'on arrive à 20 conférences pour les parties, surtout au Moyen-Orient et Nord d'Afrique, pour la croissance durable 2050. Et en plus, la stratégie de l'Organisation des migrants est pour améliorer beaucoup plus la qualité de santé et surtout avec la coopération avec les concernés pour trouver des solutions pour ces défis. Et aussi, il y a un rôle très important pour ne pas laisser tout ça sans bien planifier pour renforcer le système de santé et pour éviter et pour répondre à ces ressources de santé pour la vision commune pour un futur durable. À la fin, on doit penser que la santé est très importante pour notre bien-être et pour aussi les migrants. Il faut qu'on voit ça globalement pour pour protéger la dignité pour tout le monde. Et maintenant, il y a une présentation de Dr Ahmed, et le directeur régional de l'Office des migrants au Moyen-Orient. Et il a présenté beaucoup, il a fait beaucoup d'efforts pour améliorer le système de santé à Oman. Surtout, c'était un directeur régional qui a travaillé sur cette amélioration. Au nom d'Allah, messieurs et mesdames, merci pour m'inviter à être ici dans cette conférence. Nous sommes là pour discuter les changements climatiques qui impactent la santé des êtres humains, et on a une responsabilité vers notre planète et la population, et on doit faire tout, on doit se coopérer pour la croissance durable de cette région. Et comme vous savez, le climat change toujours, et ce sont des cas urgents maintenant que nous vivons. Et on voit maintenant en été, surtout en été, que les problèmes augmentent, surtout en Libye, qui était impactée aussi à cause de ça. Maintenant, aujourd'hui, ça pour contribuer à la mort de beaucoup de gens, et qu'on estime que les changements climatiques vont être plus dangereux pour la vie des gens, surtout l'augmentation de chaleur, la pollution et aussi l'incendie, et aussi le manque d'alimentation, et qui augmente les maladies et les pandémies aussi. Et ça, le changement climatique a changé aussi l'eau potable, l'eau propre qui est là dans les zones comme en Palestine, qui dépendent sur l'eau pour l'agriculture. 7 d'agricoles ont laissé leur terre à cause de l'eau, le manque d'eau, parce que l'eau devient très élevée, et à cause de la vapeur de la mer au Moyen-Orient, à la Méditerranée, qui peut être augmentée dans ces pays à la mer. Et il y a d'autres pays qui n'ont plus d'eau à cause de sécheresse, car il y a plus de pluie. Alors, la Banque internationale estime qu'il y a à peu près 11 millions de personnes qui vont mourir à cause de ces problèmes volcaniques aussi. Il y aura aussi à peu près 2050 qu'il y aura beaucoup d'immigrants comme estimation, et aussi l'impact sur la santé à cause du changement climatique. Ça aussi, c'est un problème majeur. Et on estime aussi que ce changement alors, il faut qu'on mette en place des stratégies durables, surtout pour les gens, la population vulnérable, les enfants et tous les individus. Et tout ça dépend. Par exemple, en Égypte, en 2030, que ça demande 50 millions de dollars, et beaucoup des mesures dans tous les secteurs dans cette région qui doivent se croiser pour cette amélioration. Les Émirats va accueillir une conférence, et ça va être le sujet crucial dans cette conférence pour les changements climatiques et l'impact de la santé au niveau international. Et maintenant, nous voulons accueillir Dr Ahmed Soueida et Dr Arod du ministère de la Santé de Koweït pour nous rejoindre pour nous joindre à distance par Internet. Dr. est un spécialiste de la santé publique et un conseiller dans le ministère de santé au Koweït. Il a une expérience qui dépasse de 25 ans, dans le ministère de Koweït, dans la science de pandémie. Azarqawi est un médecin aussi qui travaille dans le département de santé et les affaires d'écologie et un membre aussi dans le comité régional de climat au Koweït et dans la durabilité aussi, le comité de durabilité écologique. Et comme il vient de parler, le directeur, quand nous avons déjà commencé à travailler avec le ministre de Santé pour évaluer des ateliers en ce qui concerne ce sujet, et surtout les migrants et aussi sur les migrants et les populations mobiles, en ce qui concerne la santé et aussi. Les deux vont parler sur le changement climatique et aussi les gens, les vulnérables et les populations mobiles. Nous espérons que vous nous entendez. Vous entendez bien. Bonjour. On peut commencer. Est-ce qu'on peut partager les diapos, s'il vous plaît?
Sure. Yeah, maybe it's better to share from your side, and we'll go from there.
Sure. And if you want us to move to the next slide, if you can say next, and then I will move your slide.
Excellent. Good morning again, and thank you for having
Bonjour, messieurs et mesdames. Merci pour cette invitation. Je suis j'ai l'honneur d'être ici avec vous pour ce sujet très important. Moi, je suis Dr Mohamed et Dr Ali Zankawi, qui va être avec moi pour participer à cette présentation. On va parler brièvement sur le changement climatique et comment ça a impacté sur la population dans cette région. Donc, pour le sommaire de cette présentation, le changement climatique en général à Koweït et aussi le changement climatique et la santé. Et après, on va discuter sur les mesures et l'estimation sur le niveau d'adaptation à Koweït, de santé à Koweït. Et les défis aussi vont être Koweït est comme les autres pays voisins, un problème d'augmentation de chaleur, la température excessive et de climat très sec. Et aussi, il y a un grand changement climatique, y compris l'augmentation de chaleur. Par rapport à l'estimation, alors que la température 1,7 dans les cas plus difficiles, comme nous voyons ici, que ce n'est pas le degré moyen, que la température soit 1,7 chaque jour, mais le problème que la chaleur excessive ou la température excessive qui augmente chaque jour de façon rapide, et ça se montre que l'importance qu'on va envisager par rapport aux risques qui va être augmenté dans le Koweït et aussi les autres régions. Comme vous savez, qu'on a vu ça récemment, surtout les
because
dernières
of the change in
décennies,
climate, because of the increased desertification,
à cause du
there are
changement
more
de
days where
climatique
we have dust storms and
et aussi
dust in the air,
les
and we
problèmes de
have these
désertification.
events. Next.
Et à partir de cela, les crises
And we are a
s'augmentent chaque
developing
jour.
region. We are
Et on a
our urban
de
environment
futur
is
ou
becoming
un
more
avenir.
dense. We have more people becoming more
Et on a
urbanized.
aussi,
The population is
et
growing,
on est
and
aussi des
as a result,
environnements à cause de l'augmentation de
having that
population
combination with
qui
climate change
résulta,
will increase the
qui
need
résulta
of
le changement
air
climatique,
conditioning, increase the
l'utilisation des
need of
ressources
indoor
et les bâtiments aussi.
temperature cooling,
Tout
which
ça
also
impacte
raises
le
the
degré de
risk of
chaleur.
urban heat islands in the
Et
area,
ici, les
especially
îles ici
cities, especially that most
qui
of
ont
our
aussi
countries are becoming more and
de
more
chaleur
urbanized,
ou
and
de
that
température
affects
excessive.
the city
La
areas.
plupart
Next.
des villes et les villages aussi. Deuxièmement,
This is also the torrential rain, the flooding has
il y a
become
d'autres,
more and more
comme vous voyez
commonplace
ici, comme
in the
la
past
pluie.
years, and we've seen that in many of our countries, and how this can damage the infrastructure, how it can cause injury
Comme vous
and
voyez
risk to
ici,
human life.
à cause de
Next.
l'inondation et qui
So
influence
next,
des
we'll be
problèmes
talking about
financiers.
the
Et
climate change
on va
effects
parler dans
and
ce
health
troisième
in general.
slide
Please
sur
go to the next slide.
le changement du climat et la
So,
santé
in
et comment
terms
ça
of
impacte
climate change
la
and
santé au
health,
Koweït par rapport
because
à
of the
l'effet du
particular
changement de
risks that we
climat
are seeing in the
sur
region,
la santé.
we are seeing the increased temperatures, we are seeing the unstable
Premièrement,
weather, we are
l'augmentation
seeing
de morts
that could affect,
et
have
aussi
a
les problèmes
specific profile risk
respiratoires dans
for
la
our health.
plupart.
And that is injuries, diseases, and deaths due to heat-related mortality,
Des problèmes
circulatory,
cardiaques aussi
cardiovascular, and
et le
respiratory
système
related diseases
respiratoire
can be
et tout
indirect
ce que
effects
concerne
as well
aussi
as
les
direct
reins, les
effects
problèmes de
of
reins
these
et
high
aussi
temperatures and
des problèmes
extreme
de
weather,
santé
where
qui
individuals
causent
are at
l'augmentation de
increased
morts.
risk of chronic diseases due to the inability to do physical activity, the
Et aussi
inability to
l'augmentation de
walk, and
pandémies
their
et
exposure to the
épidémies à
environment.
cause de
And
crises
of course, we
climatiques,
know the
à cause de
disaster-related
l'impact sur
mortality
l'environnement
that we
avec
are
la
seeing.
catastrophe
Next.
naturelle.
And in a short explanation, we see, and this is very
Dans une
particular
brève
to the
explication,
migrant
nous avons
population,
vu
and I will explain that in a bit. So the direct
des
effects
cas
that we are
dommages sur
seeing
la
are
santé.
of
Ici,
temperature
l'impact
considered heat exhaustion related
direct à
to
cause de
severe headache,
l'augmentation de
dehydration, muscle
chaleur, comme
cramps,
les
also
migraines,
fluids and
le manque
electrolytes, and
d'eau dans
that
le
could lead
corps,
to a more
et
severe
aussi le
state, which
problème
is
de
heat
muscles,
stroke,
et
such as
aussi
loss
la
of
perte de
consciousness,
liquide
reduced
d'eau
ability to
dans le
sweat,
corps
high body
des
temperatures, and
êtres humains,
inability to reduce
et aussi
body temperature. And
l'impact
this could
excessif
be
de
a direct
température de la
effect, a
chaleur
direct cause of mortality due to increased temperatures. Next.
et
Of
d'autres
course,
maladies, comme la perte
we're
aussi
talking about
de
air pollution due
connaissance.
to dust
Et
storms,
aussi
and that could
d'autres problèmes
predispose a
en
lot
ce
of
qui
people
concerne
to
l'allergie
allergic
par rapport à la poussière et les vents
diseases,
de
as well as
poussière et
pollution-related
des allergies
cardiopulmonary mortality.
respiratoires
Next.
et aussi des
In
problèmes sur
addition,
les
we're
reins aussi
seeing
à
the changing
cause et de
environment
moments aussi à
cause
cause de
growth
le
environmental
gaz
transmission of different pathogens
et aussi
and
les
changing
maladies qui
distribution of
viennent d'eau
waterborne diseases, and that could affect the food
et
safety
aussi
and
la
water
pollution
drinking
d'air
water safety
qui
in the
augmente
region.
chaque
Next.
jour, qui emporte tous
Furthermore,
ces
and
problèmes et ces
we're seeing
maladies,
this, there
en
is
plus,
a change in the
y
temperatures,
compris les
and along
maladies,
with that, there is a change in the distribution of vector-borne diseases such
et
as
qui est transmis
mosquitoes,
par
and with that, we might be
l'eau, c'est
affected
que
by
la
diseases such as
fièvre et
malaria, dengue
aussi
fever, Rift Valley
les
fever,
pandémies
and other viruses that are
respiratoires.
transmitted by this
Et
change
il y a d'autres
in
aussi virus
vector-borne diseases. Next.
qui se transfèrent par l'eau et
So
par l'eau et par
this
l'air
is where
polluant.
we are really focused today. We want to talk about
Et
the
les parties
occupational
qui est
health
plus,
and health of vulnerable
le plus
populations.
impactée
We've
est
seen a lot of these
les travailleurs et
climate
les
change
personnes qui travaillent à
factors and
l'extérieur toute
risks
la
that are
journée,
happening.
qui ont
Those who
l'impact
are exposed
direct
to them
avec
are those
la
who
chaleur du soleil.
are going to be
Alors,
suffering the
ce sont,
most
comme vous
or
voyez
are
ici, ce
going to
sont
be
les
more
gens
vulnerable. And of course, those are the individuals who
qui ont
work
influencé par
outdoors,
ces
especially
changements,
those who are unprotected.
qui
So,
travaillent tout le
so
temps à
this
l'extérieur
links
de
back to
maisons ou des bâtiments.
the migrant health
Et ce
and
que nous
populations who have
ce que nous montre ici l'importance de ces populations qui est le plus vulnérable. Et alors, on doit penser comment on peut les protéger. Et aussi, il y a une partie de la population, par exemple, les personnes âgées. Et si on parle de la population mobile et aussi les problèmes des maladies, les maladies qui sont ressenties par les migrants aussi, c'est la dépression ici et aussi les problèmes psychologiques.
This is the point I'll hand over the presentation to my colleague, Dr. Ali Zarqawi,
Et
to talk
maintenant,
about
on va passer à mon collègue Ali qui va parler sur l'avancement de ce sujet à Koweït. Merci, Dr. Mohamed. Et je vous remercie tout pour cette invitation. Et j'espère que j'étais ici avec vous à Riyad, mais mais j'ai pas eu le temps pour être avec vous ici sur place. Il y avait un travail essentiel dans le centre, notre centre, et comme vous saviez, la pandémie de Covid
we covered a lot of ground. It took a lot of work.
Can we show the
Can you move to the next slide, please? So if you're not familiar with the steps of the vulnerability and adaptation assessment, I think there's a mistake in the slide. There's a duplication of one of those steps. It has probably changed, but it's okay. So just to go through them quickly, step one is the planning step. Then step two is the vulnerability assessment. Then we move on to the capacity assessment, then the future risk assessment. Step five is the adaptation assessment, and six is the synthesis of the report. Next slide, please. So we have completed the first step, which is the planning stage. I'm going to briefly describe the sub-steps of this one because it's quite important. Can you move to the next slide, please? So step 1A was the establishment of a project team. The consensus was to establish 6 teams: cardiovascular, food safety, which I'm also a part of, mental health, occupational health, which is the most pertinent to our presentation today, respiratory health team, and a technical team. The technical team is quite important. It's basically where you'll find most of the stakeholders, researchers, people working in statistics, epidemiology, policy review, and they provide support to the other team members since most of them are clinicians. So dividing this work was quite beneficial to get things moving smoothly. Next slide, please. So when it comes to defining the climate hazards, for Kuwait, the most important was extreme heat, acute weather events, as Dr. Mohammed just explained, air pollution, and dust storms. Next slide, please. Defining the time period, here we face some issues. I'm going to get back to them when we cover the challenges and gaps. So yeah, I'm not going to go through all of them, but you can see here there is some discrepancy between the data that we wanted from each of our stakeholders, and this goes back to the availability of the data amongst other things, which I will cover. Next slide, please. Here you can see the external stakeholders. Again, I think there's a mistake in the slide, but it's fine. So in addition to the stakeholders from the Ministry of Health, we have the geriatric department, the environmental inspection department from the Ministry of Health, and the occupational health department. We also have the Kuwait's EPA Meteorological Center, Kuwait Institute for Scientific Research, where you'll find the members and the technical team, which I mentioned, Kuwait University, Public Authority for Food and Nutrition. Most of our food is imported in Kuwait, and this is the governing body responsible for that. The Public Authority for Agricultural Affairs and Fish Resources, which is responsible for the local food production in Kuwait. Next slide, please. So currently, as we were speaking, two steps are being done simultaneously, the vulnerability assessment and the future risk assessment. We have some data available or some results available from the cardiovascular segment of the data that we have. Unfortunately, we cannot share it at the moment, but hopefully, inshallah, whenever we can, we would be more than glad to share it with you. Next slide, please. So the future steps are the capacity assessment, the adaptation assessment itself, and finally the synthesis of the assessment into a report. Next slide. Here I'm going to talk about the gaps and challenges. You can move to the next slide. So one of the challenges that we faced was we grouped them into broad categories. One of them is the team-related challenges. A lot of our members, as I mentioned, are clinicians, and if anyone here is a clinician, they can tell you how busy and crazy their schedules are. So that was quite a challenge to get everyone together in the same place at the same time. A lot of our members have minimal prior experience in conducting the VNA assessment. However, it's been a learning experience and quite exciting, at least for myself. The WHO has been quite helpful in providing a consultant to guide us through the process too. There were unexpected delays in the cross-sectoral work, which I gather is commonplace in a lot of other places, but alhamdulillah, we got things done. Next slide, please. Here we go back to the data-related problems that we faced. So there were challenges in the data availability and the format of the data. So in addition to the data being available, there was some overlap between the government agencies, but not everyone had the same data for the same set time period. But in addition to that, we had a lot of the data was lost prior to 1990 due to the war. And authorization processes took a while because it's a sensitive data, patient data. So we had to sign NDAs, but still the authorization process had some delays. There was another issue related to the occupation of when we looked into the data in the hospitals, and we wanted to know the occupation of a given patient. Sometimes the occupation stated in the civil ID is different from what the person is actually working in, which had to be taken into account. And then finally, the last slide, if you can move on, please. Due to the nature of the committee itself, it's a government committee that's responsible for the VNA assessment. So the private sector cannot be included officially in an official capacity as a member of the committee. However, we have plans to collaborate with the private sector, given that most of the construction companies are in the private sector, and a lot of the migrant and the contractual workers work in construction. Inclusion of the community itself is also quite important. However, that's in our future plans. We have yet to decide on the specific method of including the community, but it's quite important to have them represented in the vulnerability and adaptation assessment. And that's it. Thank you.
Thank you so much. Thank you so much, Dr. Mohammed and Dr. Ali. We understand you are able to stay with us for another 10 minutes or so. So we have a time for Q&A. If you have any question, please feel free to raise a hand, and then we would pass the microphone for you. Yeah, let me see whether I can see any questions, any comments, even from the panelists. Maybe while we are waiting for any participant to raise a hand, and we also have several participants online, so if they have a question, please feel free to let us know. Maybe Dr. Mohammed, Dr. Ali, thank you so much once again for your great presentation, and great to know the initiative from Kuwaiti government. The final slide you mentioned about community. Would you be able to give us a bit more sort of detail of which community you are looking at? Is it mainly host community, Kuwaiti, community, or you are also planning to look at the migrant communities of the temporary contractual workers, and maybe potentially to engage with also origin country embassies, diplomatic missions based in Kuwait?
Actually, what we had in mind was to engage with the migrant worker community themselves. But the going through the embassy is also an idea. We can look into that. However, it's we have yet to decide on the actual method of including them. But to be honest, it was one of the recommendations in the IOM workshop that we attended in Kuwait, and I'm glad that somebody brought it up there, and we will take it into consideration.
Thank you so much. Thank you.
Also,
yes, please.
As my colleague Dr. Ali mentioned, of course, we need to focus on the migrant community, but of course, this will include engaging business owners and engaging the regulatory bodies for different organizations that manage work safety and work environment and so on. So just to add a small point to what my colleague has mentioned.
Thank you so much, Dr. Mohammed. Any question, any comments? Maybe just one more question from my side. You mentioned, Dr. Mohammed, one of the vulnerable groups include pregnant women. And indeed, gender is an important aspect when we are talking about climate change and how its impact on individuals differently, depending on the existing inequalities, including gender inequalities. Do you see any other health impact of climate change which are affecting men and women differently? And how you are planning to take that into account into the assessment you mentioned, Dr. Ali?
Of course, different, it's really important for us to look into not, different segments of the population, whether it's by age group, by gender, and by nationality. And this is what we have been doing with the vulnerability assessment. Of course, the obvious part that we are interested in is pregnant women, because there's a lot of research that's looking at the pregnancy outcomes that are related to hot weather and climate and different aspects. However, we're still keeping an eye on other possibilities on how any inequalities can be affected more significantly by climate change. I don't know. My colleague can add anything, Dr. Ali.
No, I think you covered it, Dr. Mohammed, so thank you.
Thank you so much. If no further questions, comments, then we would like to conclude the first segment of the session. Thank you so much, Dr. Mohammed and Dr. Ali, for joining online. We wish that you are here, but certainly, it's a pleasure to have you online and really hearing the initiative from Kuwait. So now we are moving to the second segment of the session, which is a technical panel discussion. So the moderator of the panel discussion is my colleague, Dr. Michela Martini. She's a senior regional migration health specialist of IOM Regional Office for Middle East and North Africa. So now I'm handing over to you the control, Michela.
Thank you, Masako-san. And it's really a pleasure for me to moderate this section with expert for from different disciplines because we are going to offer what's the objective, also complementarity view of the complex dynamic of migration, and health, and the climate change, which is still an untapped area also in the public health, but also in the migration portfolio. The dynamics of the three aspects, they still need more discussion, more study, and more element. And we have heard the data and the information from the two regional directors. We have seen also the high mortality of the climate change-induced health problems, and we have reached a large number, and we have seen 30 million every year dying for direct or indirect effect of climate change on the health. And in MENA region, we have 1 million on deaths due to climate change, which are all preventable. And this is something that we want to look at. And as IOM, with the angle of migration, we have seen the direct interlinkages with the human mobilities and the health and the climate change directly. Some of the people, they move in our region as adaptation strategies. We have seen from also the regional director mentioned. Some people, they remain trapped because they don't have the means to move. But climate change is inducing migration as well. But on the other side, North Africa, Middle East is already affected and characterized by highly movement of people that they move for economic reasons. And we have 16 million of international migrants in our region. And when they moved, even if it's not for climate change, they may be exposed in countries or in sites that they are exposed to climate change, adding a different vulnerability of the migration process. So both ways, if people move from adaptation strategies, climate change, or they move for economic reasons, they add a third layer of vulnerability, which is the migration. The migration has been agreed to be a social determinant of health. And this means action taken during migration, the way people they move, the way they reach the country of destination, they integrated, they're not integrated, and they leave the work, they make additional health exposure to them. And this is why it's so important to address the three dimensions of health, human mobility, and the climate change. And this is why we have set up this panel with the different expertise and perspective. But also the sixth report of the intergovernmental panel on climate change has clearly declared now that, I want to read exactly, confirm that the climate change patterns of mobility are detrimental to health. So it's now a reality, and this is why as IOM, we are here advocating to have more data, more discussion to address those three dimensions, especially in the region highly characterized by migration. So we will hear today from our panelists the different perspectives. We are going to hear from the ILO representative addressing issue of the workplace, particularly outdoor workplace and extreme heat. And he's presenting also the deliverable of the recent international conference dedicated to this subject area, and presenting also a Qatar case study and practice. It's going to be online. So today we have two online presenters and two, as you can see, physical or present here. Thank you for joining. So from the ILO is going to address the workplace perspective. But who are the migrants? What they really need? What are the vulnerability? We are talking about life cycle approach, people-centered. And this is why we invite, is our pleasure, Mr. Goy, that is representing the migrant voice and is going also to share his expertise and also the approach of the migrants' vulnerability in the life cycle approach. Then we know that our region is also highly affected by displacement, not only due by climate change, but we have war, conflict, and it's sad to mention even the recent Gaza-Israel conflict that is creating displacement. And we have seen also yesterday a very interesting panel discussion on fragile state and climate change. This is an extremely important also for us, for IOM, because clearly we have seen the map, and if we see the map of the climate exposed country and sites, they clearly overlap with the size of displacement people. So climate change is really affecting the most vulnerable sides of the population. And this is why we are here in the panel having the IFRC, which is going to address this element, also displacement. Our final speaker would be here in present, Dr. Ahmad. He will close the circle. He is a refugee himself, so he's a migrant himself, but he's also a medical doctor. And is going to approach this perspective, closing the circle of all the thematic area, but also bringing the attention to the framework that we can use and his expertise. So I'm really excited to see those different perspectives. And the objective of this thematic discussion, it would be mainly to spotlight the health impacts of climate change on the vulnerable segment of the society, as I mentioned before, the workplace, the displacement, the migrants itself. And we are going to discuss also the necessary policy and the intervention that we can put in place to mitigate and also prevent deaths and disability in this area, and sharing recommendations from the expert. So I'm going to give the floor to the panelists and start in this session. And the first panelist who is online, we can see the slide, but it would be nice also if you can see you, Mikhail Kandarakis. Mikhail is...
Can you hear me?
Yes, oh, now we can see you, thank you. Michael Kandarakis is the technical specialist on labor law and labor inspection and occupational safety and health for the ILO project office in Qatar. He's a lawyer by trade, and he has been practicing law for 10 years. And he's a former director of the Greek Labor Inspectorate, and an ILO officer since 2013, working internationally in the area of child labor, forced labor, and labor inspection, and occupational safety and health. The floor is yours, Michael, and thank you for joining us.
Thank you, Dr. Martini. Can you hear me well?
Yes, loud and clear.
Okay. I would suggest that we put, I don't know what you see in your screens. Could you, okay.
We can
now
see the slide.
I also see the slides. Yes. I have some issues seeing everything. Anyway, Dr. Martini, thank you very much. Thanks for inviting me for this panel. I'm really sorry. I was there actually in person. I was at the conference at the beginning of the week, but unfortunately I could not remain due to other obligations here in Doha. I would like to say what I wanted to offer today to the conference and to the participants of the panel would be, first of all, some global perspectives about the approach of the ILO in the issues of climate change and the just transition, of course, occupational safety and health, with the focus being on the health of workers. And also, I will speak about our work, my work here at the office, exactly as an example of these approaches. And I will finish with the recommendations and the basic arguments that were the takeaway of a recent international conference that we organized on heat stress here in Doha. First slide, please. So I would like to start by saying that for the ILO, the effects of climate change in the world of work, the multidimensional effects of climate change in the world of work have always been, for many, many years now, very obvious. And it has been a topic of very deep and very long conversations in the ILO that led in 2015, as you can see in your screen, in the adoption of the ILO guidelines for a just transition towards environmentally sustainable economies and societies for all. I will put a focus here. I would make a note on the word of societies and not only economies. I would like to say here, for those of you that do not know it, that the ILO is one of the specialized agencies, of course, of the United Nations system, devoted to the world of work and everything that has to do with work around the world. But we have one peculiarity that I usually want to note and focus on, and that is that we are directly governed by the tripartite constituents of the United Nations and, of course, the ILO. That means that any decision and any major production of international laws, treaties, conventions, or recommendations by the ILO is being consulted and is being co-decided and adopted by the governments, the workers' representatives, and the employers' representatives that gather in Geneva at least 2 or 3 times per year. So, in that sense, these guidelines were also adopted by all the social partners, all the constituents of the ILO and the United Nations. Now, the effects, as we have identified them, of climate change in the world of work are, of course, financial and have to do with changing practices in work, in how work is conducted around the world, but also in provoking displacements of workers and entire categories of workers around the world. But at the same time, of course, we have to focus on the health impact of climate change in the health of workers, both those that remain in their origin countries working, but also in the ones that have to be displaced and have to find work elsewhere. In many cases, as we can see it here in Qatar also, in many cases, transporting to a different environment altogether and different climate altogether, and we will have to adjust to. Next slide, please.
Should we change it from here?
Okay. Now, a second global and very, very important issue that I would like to speak about would be
Michael, are you with us?
that.
I think the line
is everything okay?
Now sounds okay. Please go ahead.
No, I will. Okay, I will turn off my camera.
Yes, please.
Maybe it affects my connection, although I'm in a good connection. Anyway, so during the International Labour Conference, that is one of the platforms, as I said before, that all constituents of the ILO gather in person and discuss the issues. We had a very, very important change, and that was that occupational safety and health has been recognized now as one of the fundamental principles and rights at work by the ILO and its constituents. This, the rest, for your knowledge, if you don't know it, the rest of the fundamental principles and rights are child labor, forced labor, to the fight against discrimination of any kind, freedom of association, and freedom of association. That has a very practical and very operationally practical effect. And it means that the countries, all countries around the world that are members of the United Nations, so members of the ILO, have, in good faith and in accordance with the constitution of the ILO, they have to realize and promote occupational safety and health in their national legislations and national legal frameworks, and they also have to report about this progress every year to the ILO, whether or not they have ratified the relevant conventions. I don't want to get to be too technical here and stay too much this point, but whenever a country is ratifying one of the labor conventions of the ILO, they essentially accept the obligation to report on that convention, with the exception of the fundamental conventions, the conventions that are relevant to the fundamental principles and rights, for which they have to report independently of having ratified or not the relevant conventions. Next slide, please. Now, at global level, there has been, as you can see on your screen, from February to April of this year, there has been a review of international policy responses on climate change, heat exposure, and occupational safety and health. And what was found that overall, unfortunately, there is a global lack of policy responses. Most policy responses, national policies, that is, are from European countries, 16 out of 26. And about all of them, from all of them, around 70% was published and was adopted during only the last 5 years. At the same time, the heat stress problematic has been always anchored in climate change adaptation policies. So it is anchored in broader climate change concerns, which is a good thing. And also, half of the cases in the policies also include practical tools such as guides, action plans, or risk analysis, besides legal frameworks. And of course, more than half of the reviewed responses focus on heat stress in particular. I have to say here, before we go on, that yes, the ILO work is mostly focused on heat stress, but do take under consideration general concerns about extreme weather phenomena more broadly. Next slide, please. I can't see
the slide.
Yes.
Is, okay. Can you see it?
Yeah, no. Yes, now I can see it. So I mentioned before about how in the ILO we have been discussing since 2013 and even before that about the effects of climate change in the world of work, but focusing more on the occupational safety and health side of things. You can see again in your screens that the climate change essentially poses many challenges for the existing occupational safety and health priorities, and also policies and guides and guidance that have been produced before. And in that sense, we need what in the ILO we call an integrated approach that essentially ensures that the answers to those problems and the answers to those challenges are not one-dimensional, but they are multidimensional. This means that we need to have comprehensive policies that go from the protection of workers at the legal level, at the legal framework level. They also have to do with training and educating the general population, the employers and the workers on the risks that they are facing and the responses that they have to promote. It means also that we have to integrate at establishment level have integrated policies and action plans in how to deal with heat stress or heat exposure, and those action plans have to be based on specific risk assessments that will be done also at establishment level. Next slide, please. Now, the guidelines of 2015 that I just mentioned are an umbrella, I would say, policy document that sees the issue of just transition and climate change from the general perspective, but it has been supplemented in the years since 2015 by more specific policy documents and policy guidance documents that deal with different aspects of just transition and the world of work. The last one, again, you can see it on your screens, is from this last September, that is focused especially on occupational safety and health in a just transition. And I would like to just point out some of the, these are what you see in your screens are the main points that the guidance is making. And I would like to stay, as I said before, first of all, at the multidimensional challenge that climate change poses to occupational safety and health, the protection of the health of workers. And also, as you can see, we don't only mention the heat stress, but also other extreme weather phenomena, the exposure to hazardous chemicals, air pollution, and infectious diseases, among others. And all of these factors, most of the times, are given in the same context and at the same time. And this is the multidimensional challenges that we are facing. Of course, you know better than me, and with WHO, of course, they have much more expertise than the ILO in identifying the many different health effects that heat stress has in the life in the health condition of workers. Also, as I mentioned before, the occupational health and safety responses, the policy and the practices have to include risk assessments at all levels. So they have to be essentially evidence-based and not just out of practice or habit. And also, we note here, as it should be obvious, that occupational safety and health is critical to just transition. It has to do with the risk that arise not only to environmental changes, but also in the changes in the world of work and the practices and the processes of work. Next slide, please.
Qatar.
Now, going to Qatar. Yes, thank you. Going to Qatar, there has been a very extensive research that was done by a specialized university of my home country, Greece, in 2020, and it measured scientifically the effects of heat stress in Qatar. I believe it was around 60,000 workers in both agriculture and construction. That research was commissioned by the ILO together with the Ministry of Labor of Qatar, and essentially formed the basis of a legal amendment or a legal reform that was done in the protective legislation in Qatar. And again, as you can see on your screen, that legal reform expanded the ban of outdoor work, both during the day, but also as a period in the year, from the 1st of June to the 15th of September, and from 10 a.m. until 3:30 in the afternoon. Next slide. Also, there are two more slides of additional measures that did not exist before in the legal framework in Qatar, and that is that all employers have the obligation now, the legal obligation, to prepare risk assessments on how to mitigate heat exposure in their establishment. We have instituted mandatory annual health checkups for all workers that not only work outdoor, but are in any way affected by heat, we have constituted the right of workers to remove themselves when they feel that they are threatened in their life or health. We adopted the wet bulb globe temperature index to assess the exposure, the heat exposure, and that means that we don't only take into account the absolute temperature, but we take into account any other factor that might contribute to the heat exposure, that is UV radiation or wind speed or humidity and any other factor. And of course, all work, independently of where it is being done, either outdoors or indoors even, has to stop when the WBGT index temperature rises beyond 32.1. Next. I have had questions from many people saying that 32.1 is a very low temperature to prohibit work. And then that's why I included this slide, because this is a 32.1 in the WBGT index, which, as you can see, already we are at yellow from 29.4 degrees Celsius in this WBGT threshold. And I have to tell you that this table that I have included here has been created for athletes and not even for workers that essentially have to be exposed to those temperatures for longer times, and even with more strenuous physical activity than an athlete would. Next slide, please. Now, the second batch, the second category of measures that were included in this legal reform was that
Michael, the line is broken again. We cannot hear you. And if you can, yeah, if you can.
Pure shaded rest areas at close proximity. Yes, I'm sorry. Okay, and of course the personal protective equipment. Let's continue this.
Yes, please go ahead, Michael. Okay. Yes.
This I will not say, just that together with, of course, the obligations of the employers, the Ministry of Labour and ourselves, we have prepared a number of training and education materials, both in the format of YouTube videos and also electronic documents that are translated in many different languages of origin in Qatar to provide guidance to employers and workers. Next slide. And now, yes, the conference, 9 to 10 May, last May. So we gathered in Doha, we gathered a number of scientists from all around the world that have years of experience in research and policy design on heat exposure. And also many of the most, I would say, of the governments of the Gulf region, with representatives from the ministries of labor at both political and high technical level in those ministries. And we had these 2 days of conversations and presentations about how heat stress affects workers and what should be done to mitigate the dangers of heat stress. Next slide, please.
If you can start also concluding, Michael, for the time also. Yes, I can see your conclusion.
I can tell you, Justin, let's not, I mean, these are 2 slides again that I could be speaking for minutes and minutes on those, but I will tell you essentially 3 or 4 that are the main. Actually, let's go to the last slide. I think it's better to end up with this one. So slide, and then the next one. Please. Yes. So I would say these thinking ahead, the next steps that we have already decided to work on in Qatar, together with our partners at the Ministry of Labor, are what essentially are the recommendations of the HITSES conference. And I would really invite you to take a look at both the awareness material before and also the webpage of the conference, where you can find all the presentations and the recommendations document in total. But as you can see, the main points that were made during the conference is that the research efforts in Qatar, but also internationally, have to be deepened and have to be strengthened and expanded to other areas, like, for example, other populations or indoor workers or other measures that can be adopted to protect workers better. Second, the identification of medical tests dedicated to the prevention or early detection of heat-related health issues. This is something that is pending in Qatar, but at the same time is something that is missing from many or most of the legislations around the world. Identify specific medical conditions and try to find them out early or treat them when it is possible to treat them. The third point is that all protections have to also be expanded to indoor workers, but also to other individual vulnerable groups, like, for example, women or younger workers, or people that have preconditions, health preconditions that would affect them more dearly if they would be exposed to heat. I will leave it here. I thank you again, and I'm sorry if I take much more time. I shouldn't.
Thank you so much for the comprehensive presentation through 3 different topics, the conference, the ILO perspective, but also the Qatar experience. That was very, very interesting. And actually, it will be even more interesting in the way ahead to see the impact of this new policy. Are those really the gold standard we are looking at? And from our perspective, because we know that we are referring to mainly foreigner workers. Majority of the workers are migrants. This is why we work together also with ILO and WHO for the issue of migration and mobility. So more also impact evaluation to see if we can, at least for this sub-region, to have the gold standard for outdoor workplace sector, and how we can better reinforce, looking at also the small and medium enterprises that they may not have all the means to put in practice. Thank you so much, Mikhail. I'm not sure if you are going to stay for the whole panel, because can you stay? Okay, so we can leave a question and answer at the end.
I can stay, yes, I can remain.
Thank you so much. So we will leave the question after all the speakers. I have now the pleasure really to introduce Mr. William Goy. And he is the current regional coordinator of the Migrant Forum in Asia. Mr. Goy is the former chairperson of the Global Coalition of Migration, and over the last 20 years, he has been at the forefront of international advocacy efforts, engaging and influencing international and multilateral processes, and promoting right-based migration and development policy. He is also a member of the World Bank-led Global Knowledge Partnership on Migration and Development, a global hub of knowledge and policy expertise on migration and development issues. So we are really glad to have you with your excellent expertise. The floor is yours.
Although let me start by saying thank you to the organizers for inviting civil society to this panel, and for what has been a fantastic week in terms of just trying to understand this discourse on climate change, and particularly in listening to the different side events in relation to migration. So let me start with first with where Dr. Ali had stopped, is about including the local, including the community. And when you say including, and Masako asked, is it the local community or is it the migrant community? And I think that is a key question to ask. Because when you look at, and I will focus on the life cycle approach, which we talk about in migration from pre-departure to return, and the temporary labor migration programs that fit within this life cycle approach. And I will focus on the Gulf region. When you look at the Gulf region and you start looking at temporary labor migration, more than half the population in the Gulf is of migrant workers. There's only one country, probably Oman, where you have a slight majority of the locals. But everywhere else, it's a major foreign worker population. So you have to keep that in mind. So locals around the region, somewhere between 26.4 million, and expats, foreigners, migrant workers, somewhere between 28, 29 million. So those are the figures you are looking at. So when you talk of climate change, adaptability, resilience, community inclusion in relation to health, how do you even start a conversation with such a diverse population, where the only possible common language would be many shades of English, from 2-3 words to quite a good understanding of it. So how do you do that reach out that Dr. Ali was talking about? How do you grapple with, how do you get them involved in what would be a resilience strategy, particularly in relation to health? I think that's going to be important for us to look at. One of the things we've not considered, and I haven't seen brought up in this climate week, is to see migration as an adaptation strategy. I think we've got to start recognizing that migration might be or is an adaptation strategy for many overseas migrant workers. For example, the recent floods that devastated Pakistan. How many workers from that region, from Pakistan, lost everything and then came on as labor migrants to the Gulf? We don't have that kind of data. We know in the Philippines, whenever there is a typhoon, that's the time traffickers and recruiters go to that region to say, look, everything has been lost. Why don't you go and work abroad, overseas, and recover from there? So many workers, many migrant workers, OFWs, they take this opportunity to respond to a crisis that has devastated their lives. And it's a way of adapting. And when they come and work, the remittances that they send back is part of their resilience to build back from ashes. But we don't problematize this within migration discourse like that. But only if we did, then we would be able to understand this link it up with another issue that I will talk about later on. But that might be something to look at, How do you start looking at migrants who have come in these kind of situations as responding to climate catastrophe and migrate because of that in temporary labor migration programs? How do you account for the trauma that they might experience? The trauma of losing everything, family, household, whatever, and then going to a foreign land and working, taking whatever job they get, low wage, low skill, just to survive, to send some money home for the rebuilding. But we've never considered, at least I haven't seen yet studies in looking at that trauma of change. Is that an issue that we need to start looking at? Do we need to start collecting data along those lines? It's something to look at, kind of thing, whether is this already an opening for us in looking at how adaptation, resilience, migration, health is part of the greater climate change discourse. When we talk of heat stress, and Michael gave a fantastic presentation of the ILO on heat stress, and before that, Dr. Ali gave. And now, just a couple of days ago, Guardian reported on a story that they have carried 2-3 days ago in their paper about infertility among migrant workers, Nepali migrant workers who have spent long periods of time in the Gulf. And the implications of that for Nepal and its population kind of thing. So, but when we start looking at that, and these kind of situations that Dr. Ali and Michael were talking about, what is the access to health that is available then for migrant workers, kind of thing, is something we have to start looking at as well. And not only in terms of access, but access in a life cycle approach would mean in a continuum, even when they go back home. Because obviously there are certain medications that are available in this part of the world that might not be available in another part of the world. So in a life cycle approach, do you have to take that into consideration for workers who are going back? Will this medication which they have now become dependent on, is it available back home? This kind of treatment which now they need regularly, is it available back home? What would be the responsibility in a life cycle approach in migration governance to start considering that is something we might want to think about. What we don't see and what we don't normally talk about is workers in an informal sector in this part of the world kind of thing, and most parts of the most migration corridors, or even in emerging economies like the gig economy, the delivery boys and things like that. Here, of course, when we come to, and we saw that there's a lot of urbanization and concentration on urbanization, but many migrant workers also come to the agricultural sector, to the animal husbandry sector. You know, there are thousands of, let us say, camel farms in this country. You know, and what are the access to health issues that these workers, because it's camel farms, you have to be out there in the desert in the heat, look after, care for the camels and things like that. Where do we get data on this? How many migrant workers are within this kind of a sector, of the informal sector, which exposes them to a lot more health risk than from the formal sector that comes under, you know, industrial workforce? Something I have always grappled with and I've never been able to find answers to is the way we construct the neighbor migration programs. When you go to accommodation places of migrant workers, particularly those in the low wage, low skill kind of sector, these accommodations are huge, big compounds where you have hundreds, even thousands of workers in one vicinity, all male kind of thing, who are at least for a minimum of 2 years, because these contracts are for 2 years. So for a minimum of 2 years at least, cut off in a real sense from their families, from normal neighborhoods, because these camps are away from the cities and neighborhoods kind of thing, away from the city centers and things like that. But they live in these accommodations for 2 years, transported to work, brought back, transported to work, brought back. What is the mental health? How do you gauge mental health of workers in this kind of a setup? You know, because health, the way we look after ourselves is we have our social health to think of, life-work balance we think of, we have cultural activities that we partake of, we have a social life, a family life that we participate in. All this is kind of out of bounds, at least for a minimum 2 years, for these men in the thousands in these accommodations. Does it have an impact? Are there studies on how this affects their own understanding of what society is, their own understanding of what culture is, and their own responses to their own families when they go back? How do they adjust back in a family setting when they've had this kind of life for 20, 30 years? Because the going home is only for sometimes 3 weeks, 2 weeks, that kind of thing, after every 2 years. But when they finish and go back, how do you look at that? How do we measure health, holistic health in that kind of regard? Is something that we might want to think about as well. I think there are fantastic opportunities here for us learning from this region at the global level as well. The current DG of the ILO, of the IOM, Amy Pope, has talked about regular pathways and climate change as one of her priorities during her mandate. I'm wondering if we can look at labor migration programs, learning from what we have in this region, improving on what we have in this region, and keeping in mind the kind of mental, holistic health that we need to for migrants kind of thing. Is that a possibility in relation to kind of climate change? What would a comprehensive strategy look like when we start looking at health of migrant workers? And remember, what I'm talking about is workers in the formal sector, workers in the informal sector, and then you also have the added issue of workers inside the household, which is domestic workers, and then you have the added complexity of the different cultures. So there are a lot of intersectionalities that come in. So if you are ever going to have a dialogue with the community, the complexity of it is quite something you will have to grapple with. And of course, different countries that come in, workers that come in from different countries of origin, they come with a different understanding of health and background of access to health even kind of thing, and responses to health. So there's a lot that needs to be unpacked when we look at health within the migration kind of discourse. And that's why I think there's a lot of opportunity to learn. In this last Climate Week, I'm amazed at what was presented in terms of researches, technical researches on carbon capture and things like that and all. But this is a whole area of research that we've heard nothing about. But it would be tremendous if we had research like this, because I don't think it's a rights issue anymore. I think it's searching for our own humanity kind of thing. It's understanding our own humanity that is becoming crucial now, even as we engage with climate and looking at this. So if I started by saying that for some it is an adaptation, resilience strategy, migration, then if we even recognize that within this region, then what would contributing to a loss and damage program look like? That might be something to look at. In a certain sense, we have been indirectly, by giving them jobs, but not questioning the root causes of why they are moving, but by giving them jobs, we have, in a certain sense, indirectly contributing to loss and damage. But what if it became more formal? What if it became a program? That would be some way of contributing to this climate discourse in a way that brings people together, in a way that builds resilience, builds adaptation, and builds a human response to the current crisis that we are dealing with. Thank you.
Thank you so much indeed to have brought the human side of what we are discussing. We keep mentioning numbers. And it looks like the problem is quantified for the number, which is fine. Public health, the size estimation is the most important topic. But what you brought is behind each number, there is the human side, and there is the humanity, as you mentioned. But I really like to see how the Michael intervention, your intervention are totally interconnected. We cannot talk about workplace element if we don't look at what is happening after work setting. You mentioned the accommodation, but there is also a community behind. There are cultural practices, there are approach, a different perspective of health. And I know also ILO has put a standard for accommodation, so it's not looking at only the workplace exit. So I can see the complementarity of both intervention. And I also note in the NSC that you are talking about access to services. And I've seen the new regulation that Michael showed in Qatar, early diagnosis and treatment. This is critical because majority of the health disability, I'm talking about disability, not in health, when they are more progressive and severe, they are treatable with early diagnosis. So in most of the case, access to service for migrants can save the life. And I also the element of the life cycle of the migrants when they return. I'm glad that you mentioned infertility. Those are the new study of the climate change, extreme heat, not only for men, but for women. Pregnancy at risk of preeclampsia, and the newborn with complication, etc. Those are new studies. So how much are we trying to prevent rather than treat? And this is something, and it needs more data as well. I could not agree more on the psychosocial and aspect of the dynamics. And this is not, unfortunately, taken into consideration much, especially when the migrants, they moved with their own vulnerability. Can be the epidemiological profile, coming from less endemic area, moving to high endemic area, or moving from less climate exposed to more climate exposed, but also the psychosocial impact and the trauma they can bring to it. Thank you for all those interesting points, indeed. The discussion will continue, definitely. And when referring to the trauma that the people is bringing, it's linked with the next panelist, which is focusing as International Federation of Red Cross, talking about displacement and forced also migration. What you mentioned, when the migrants is anyhow forced because of the flood and because there are not level of opportunity. This is also true for conflict, for war. So what is forced migration and the impact on the climate change? And we will see from Dr. Hossam Faisal. Let me properly introduce you, and thank you so much for being part of our panel, even if it's online. Dr. Hossam Faisal is a medical doctor, joined the Red Cross and Red Crescent movement in 2002 as disaster management volunteer with the Syrian Arab Red Crescent. He has over 14 years of humanitarian programming experience, both regionally and nationally in North Africa and Middle East. Dr. Hossam has been involved in different humanitarian operation, resilience program within different contexts, from armed conflict to disaster and health emergency. And Dr. Hossam is currently the regional head of Health, Disaster, Climate and Crisis Unit at the IFRC, North African Middle East Regional Office based in Beirut. Dr. Hossam, thank you, and the floor is yours.
Thank you so much for introducing me, and an honor to be with you today in this panel. I think for the sake of time, I will just maybe jump straight into that topic. I will not talk that much on the background, so I will just maybe briefly, if we talk about the MENA region, from our risk watch mechanism, we see, especially over the past 12 months, specifically an increase frequency and severity of patterns of extreme weather conditions. And that's the key aspect we are dealing with when it comes to climate change impact in the region. Of course, we have different impacts on that level related to the conditions themselves and the associated risks moving into emergencies and disasters, such as high temperatures, heat waves, the limited groundwater rainfall causing droughts, but at the same time, the scarcity of agricultural lands due to unplanned urbanization, and all of that is leading to more economic and health impact. And of course, we should not forget one of the key characteristics we have in this region, which is the high population growth. Like, we are expecting that the MENA region will be doubled in size when it comes to population by 2070. And with limited resources due to the climate change impact, plus other humanitarian crises in the region, the impact will be multiplied on vulnerable groups. At the same time, because of the climate change situation, we can see more and more increasing dependency on importation of food commodities, among others, and as well as the elements of migration within and from the countries of the Middle East and North Africa. If we take briefly, we look into the direct and indirect impact of the climate change when it comes to the health. So we see that the acute illnesses, heat strokes, dehydration, deaths, and trauma, psychological trauma due to those weather conditions. But the indirect impact, we look into, of course, the limited water and hygiene services. We look into the livelihoods loss, food scarcity, and food insecurity, as well as the element of the impact on the lifestyle of the people, and that's mainly affecting the complications of chronic diseases in the communities we are dealing with. So all of that comes when we say a coalition or when they collate together, that leads to catastrophic situations impacting the livelihoods and the lives of local communities. Just to give you an example here from just 3 months ago in in Algeria, in July 2023, around 35 wildfires rapidly erupted and spread across the northern eastern region of Algeria, causing massive devastations. Around 6,000 families were impacted, almost 34,000 deaths were confirmed. Of course, the catastrophic situation affected the livelihoods of the people, the livestock as a main income of the communities in those locations, as well as the whole impact on the green vegetation cover in those areas. And that's, of course, resulted in hardships for communities in those areas. Of course, a lot of houses were brought down to ground, burned down completely, leaving displaced families and with dire needs from health perspective, from livelihoods perspective, but also from protection perspective. And we see that more and more happening in different areas in the North Africa, specifically leading, of course, to more risks of wash-related communicable diseases, the increased impact of non-communicable diseases due to access to medicines and the resources to get the medicines, but also the loss of livelihoods. If we move to the migration impact, and I would like to echo my colleague was talking before me from the panel when he was talking about migration being an adaptation strategy. We see that quite clearly with the migration patterns and the routes of migration, specifically if we say about North Africa. Here there are some statistics about the current situation on migration. Like in the migration routes, we can consider this here through the Mediterranean routes as the highest, let's say, reported numbers of casualties this year due to the attempt of people trying to cross the Mediterranean. Libya, as you know, it's a major transit and departure point for migrants coming through different routes on land into North Africa. The recent floods in eastern region of Libya will for sure affect the migrants who were in those areas, but also will push migrants to use different patterns on different routes through Morocco, Tunisia, and Egypt. So the issue of climate change impact causing stress, of course, to marine ecosystems as well, and the ecosystems of the fishermen and the fishers, and also to the communities using tourism as a source of income. All of that will push for more migration into or changing jobs into different locations or countries. That per se means more migration. At the same time, the impact of climate.
I think we have lost you.
Hello?
The connection is.
Can you hear me now?
Yes, we can hear you. Please go ahead.
Yeah. So in brief, I would say as well the increased risk related to health as well and climate change related to the sexual and gender-based violence and trafficking of those vulnerable migrants due to the increased numbers and the increased frequencies of and severities of the impact on those groups. Our approach as a Red Cross at the Crescent and the IFRC and the member national societies in our strategy 2030, climate change and climate change adaptation and mitigation sits at the heart of the work we are doing with our member national societies, with a huge investment looking into local solutions, local-led actions, and also adopting better environmental management in our approaches collectively and in our programming, and that takes us to the climate smart programming and climate smart disaster reduction, from increasing our work on the anticipatory action with the local communities, and that includes the migrants. I can give quickly an example here. Most recently, the IFRC and WFP, we were awarded a grant from the UK Meteorological Office, where we will work on anticipatory action related to weather information dissemination and sharing with a specific group of IDPs. So that's an important element here in terms of sometimes we overlook or overlook the element of inclusion of specific groups, not just host communities, but also people on the move in our anticipatory action and information sharing. For us, when we talk about climate smart DRR, we look into early warning, early action, raising awareness at community level and increasing the community knowledge, looking into the legal base in terms of helping and supporting governments to improve their disaster laws, moving to community solutions from community-led risk assessments and planning, increasing the element of nature-based solutions as a response option in our programming, and importantly in this region, the urban resilience component. So that's in brief. I wanted to give you an overview of how we see that from our perspective, from the IFRC, from the International Federation of Red Cross and Crescent, together with our 191 members across the world, bringing a local network of 18 million volunteers coming from the local communities, representing the local communities in their own advocacy and in their work on a daily basis. Over to you. Thank you.
Thank you so much to have really complemented with this interesting part of, as you said, people with forcibly moved, and also to mention the Mediterranean crossing. And we should also mention the Gulf of Aden and the other, what we call the mixed migration flow that is going from, starting from the Horn of Africa toward Djibouti, the desert, and then crossing Gulf of Aden through Yemen to reach actually the Gulf, Saudi. And then we know that that route is also increasing, and mortality, disability is enormous, and more attention we need to give also to those aspects. And some, actually, IOM has done a study from the Horn of Africa on these migrants, and 40% of the people were, of course, forcibly to moved, and around 35% because of climate change. So is also those mixed migration are changing in the nature, and more people is crossing in such a hardship situation because of the climate change. And again, I agree also with the more data we need. Thanks also for sharing your perspective on the inclusion of also human mobility and the migrants into the DRR and all the adaptation strategies. Thanks. I'm going to present the last speaker for today, and then we will open for question and answer. So it's a really pleasure to have with us our Dr. Ahmad, Dr. Ahmad Ouda. He is young. We are all young, differently young. But he's a young medical doctor, but he's proud to say he's also a Palestinian refugee. And he holds the status of refugees according to the Geneva Convention 1951. He is a medical doctor, as I said, and he's currently in Egypt doing his internship, so we are neighbors. And he has 4 years of experience in different UN agencies and youth constituencies. He is one of the coordinator team of the YONGO for the MENA Climate Change Week. YONGO is one of the 9 civil society constituencies of the UNFCCC. So we are really glad to have you. So the floor is yours, and please feel free to share also your personal experience and the angles of the global or some frameworks that you feel like they can be relevant for our discussion. The floor is yours.
Okay. Hello, everyone. Good morning, good evening. Are you still here with me? Because I'm going to be starting sharing my personal experience first, and then I will start from the global level from New York. I got the refugee status from my grandfather since the 1948, so we are the special case of the refugee. We are intergenerational refugee status, like literally with an infinity, I can say. So let me start from the global level, from the UNGA, and we had the UNGA the 78 in New York this year, and there was one of the high-level meetings about the universal health coverage, which is so important topic. And this year, they focused about very valuable topics. One, accountability and access to ensuring that everyone, regardless of their social economic status, geographic location, or other factors, has the access to essential healthcare services. This is the heart of universal health coverage, and involving and removing all the barriers and the challenges that facing us to access into the healthcare. Second, healthcare services delivery, discussing how the healthcare services are actually provided during the crisis too, and including the equality, including the availability of the healthcare facilities. Medical actually professional, are we having a capacity from the medical professionals, from the doctors or not? Also about the technologies and its involving the strengthening of the health system. Finally, financial protection. Protecting the individual and households from the financial burdens of healthcare expenses. Often through mechanisms like health insurance or maybe government funding to provide the catastrophe of the health care cost. All these focused on the goals that meeting into protecting the vulnerable groups, which is migrations, refugees, women and children, and also the older people. We are in the MENA region, unfortunately, we are facing a serious challenges from the different of the conflicts, and this increasing the number of the refugees. We having a different kind of the refugees actually. We have climate refugees, we have war refugees, we have economic crisis, so that will be leads into someone to move and leaving their homelands to go and to work into the other countries. So we are facing a different kind of the crisis. The common problem with the refugees is the policies of the member states. unfortunately, most of the member states are putting some regulations and limitations on the refugees, so they cannot access into the healthcare system. They cannot access to the education. They cannot access into the jobs. They are literally cannot have a sustainable life, which is one of the basic human rights, to having a sustainable life from all of the human rights that we are discussing. The second main challenge is the language of the Geneva Convention. The language of Geneva Convention, unfortunately, is not and does not protecting the refugee rights. Why? Let me here explaining why. They are saying into the Geneva Convention, we are recognizing the problem, but we are recommending. But they didn't say that we are must helping, we should helping. No, we are recommending the member state to do that. So there is no real commitment. Nothing is obligatory for the member states to protecting the refugees. This is the second, unfortunately. Also, what I found, it's actually interested into the Paris Agreement. And here's the heart of the point, that even the Paris Agreement, they don't have a single word about the climate refugees or about the refugees' right. So if we're having a refugee, like if we're having a climate crisis, like what happens in Libya, what happens in Morocco from the earthquake, all these areas does not having displacement people, so they are not recognized by the Paris Agreement. Then, if they are not recognized by the Paris Agreement, then who will be recognizing them? So this is also, like, I'm sorry, but I'm get touched, because if I am right now having floods in my country and I need to leave it, then where I should go? Also about the Paris Agreement, however, the agreement does acknowledge the importance of enhancing the ability to adapt and to advise the impact of the climate change, and recognizing the need to strengthen the global response to the climate-related loss and damage. While the Paris Agreement itself does not provide a legal framework for protecting the climate refugee or the people who is at displacement. Also, the Paris Agreement does encourage the parties to enhance their support for the adaptation. So the adaptation here is our entry point, because if we will have the adaptation, which will be indirect benefit for the vulnerable communities that facing climate-related displacement. One of the main opportunities that we need to put on the table for next COP, and we need it urgently, is climate security. We need the refugees' rights to be discussed and to be negotiated in the COP, and it should be in the COP. And thankfully for the COP28 presidency that they put a relief day, which is focusing about the refugee. Also, let me take you into the SDGs. How we can saying that we're gonna be achieving the SDGs by the 2030 and we are leaving behind the refugees. So this is not gonna be happen. If we are leaving the migrants, if we are leaving the refugees behind, if we are leaving the youth, women, girls, farmers, business, we cannot achieve it. This is the main goal. So let me take you into the SDG 10 and the relation with the SDG 30. And I will show how they are interconnected with each other. First, inequality and vulnerability to the climate change. SDG 10 focusing on reducing inequality within or among countries, inequality, whatever the social, economic, or gender, can make a marginalized community and nations more vulnerable to the climate change. SDG 13, which is the climate change, which deals about the climate change action, it should be recognizing by the climate responses that they need to have a climate emergency response, that if we're having crisis, we will do 1, 2, 3, 4, 5. To just facilitate the refugee and to facilitate the migrants during this time. Because every minute, when the crisis is happening, every minute is valuable. A lot of lives, a lot of children, a lot of the people. TikTok right now, lives on matter right now. Let me also talk to you about climate-induced of the displacement. Climate change, as actually discussed into the SDG 13, can lead into the environmental migration and also into the displacement. So we're having here climate, like a climate migration, we have a climate refugee, we have environmental migration too. Because they are the vulnerable population, they are already marginalized, maybe forced to migrate due to the extreme weather events, like, let's say, the sea level rise or other climate-related factors. Reducing inequalities, SDG 10, can help to address, drive a displacement and create a better condition for affected population. If we want to have the health rights, then we need to have the SDG 3 with us. So here, my point here is, I want to show you how the SDGs is interconnected. So you cannot focus in one climate action and leaving the SDG 10 and leaving the SDG 3. This is not going to be happen. All of the SDGs is interconnected. Yes, thank you. Over to you.
Thank you so much for your powerful presentation. We can see that it comes from the heart, but also you said some critical important that to me are really how we can better defend and concrete the rights of the people. And then in this case, how those global platforms they really can be more enforcing, because we say recommendation is the mild. But we also see that when we are dealing with migration, is the sovereignty of the states to decide. And this is why in all the global platforms, when the signature of those platforms related to migration, there is always a big resistance to make a mandatory or binding.
Exactly.
Because at the end, for law, that's the sovereignty of the states. So the advocacy for us, it become the powerful tool. Which are the stronger arguments that we can put, and from the health perspective, where is the health diplomacy in these? In these years, I haven't seen a strong health diplomacy coming on top to influence the migration platform. Because when we are dealing with migration and health, even access to services is regulated by migration policy. If you are undocumented migrants, you may not be able to access services, not because of the public health, but because of the migration restricted policies. So where is the health diplomacy here? How we can extrapolate the data, strong argument that can bring into the table the migration platforms to better influence those platforms and change it. I could not agree the most to see how the SDG are interconnected. And actually, as IOM, we are custodian on 10.7, which is the better migration policy. What do we mean for migration policy? And this is why there's a health aspect. Where are the health policy and how the health policy then incorporated the migration aspect in order they can contribute to better migration policy. So when we are looking at migration policy, are multi-sectorials. They are dealing with the workplace, with the health, etc. Looking at that SDG and dealing with the migration, the climate change, what about the trafficking? And because we have seen during actually forced displacement and some also on the climate movement, issue of trafficking is popping up now. Because when you are vulnerable, of course, you are much vulnerable to hand in the hand of smugglers, etc. So, and there are the data, SDG on data. We have seen, we need more data. There is the SDG. So definitely the SDG, and actually the design of the SDG is also, they should be interconnected. And that is a strong message we need to work, and especially dealing with migration, health, and climate change. For sure, there is an interconnection of the SDG. I also like your aspect on climate security, and of course, and then what is the response? And this is also aligned with what our colleague from the IFRC said, how to include the mobility, human mobility into the DRR, in the adaptation, etc. So you can see also from your talk how you are interconnected and how the thematic area, they should not work in isolation, but we need more and more of this forum. And I hope with this forum, maybe we can bring the data we are looking at, the argument to influence the advocacy platform, etc. This is why usually I like this intersectoral way of dialoguing. I want to just quickly open if there are any questions for the panelists. I can see no questions so far, so it means, okay, Masako-san, please. You can connect.
Behind you.
Okay. Thank you. No, thank you so much for all the panelists, colleagues also online as well. I mean, it's a very interesting discussion, and it's important discussion as well. I wanted to ask, I mean, thank you, William, really highlighting the importance of migration as an effective adaptation strategy, and that need to be explored and discussed further in a climate change discussion. This is what IOM, we are also advocating. And how we can also make sure that is looked into, not only maybe climate change platform, but in an existing migration governance platform, such as Colombo Process, Abu Dhabi Dialogue, Migration and Development Forum. What would be your opinion on how this could be, perhaps discussed in those existing governance platform as well as, of course, climate change discussion platforms?
I was looking for the mic. Yeah. No, thanks for the question. Look, I think for the longest time we have been struggling with saying, is climate change and migration related and things like that, I think, and the studies say, no, it's internally displaced, and then, so there's a lot of debate on that. But I definitely think that many migrants use migration as an adaptation strategy. We have seen that at least in quite a lot of the groundwork that we have done. Not in terms of research, but in terms of services to migrants kind of thing, those who come to our community. So we know that many migrants do that. And then many migrants use migration as part of their family's resilience to climate change. So it's already there. The question is, when this practice is there, whether we are willing to now recognize it, whether we are willing to start looking for data, gathering data on this. How many, like for example, the earthquake in Nepal or the floods in Pakistan or Libya or Morocco, how many people moved because this was the easiest adaptation strategy on hand for them to build back kind of thing. Maybe we need to start collecting information like that. We are not. And if we start collecting, since the GCM discussions and SDGs talk about more legal pathways, regular pathways, this would fit very well within that discussion, plus the climate discussion. It would fit very well within that kind of bracket to see this as an adaptation resilience strategy to be brought up in intergovernmental forums so that then you could develop a possible program like that kind of thing. We are seeing pockets of this kind of developments of these programs, for example, largely in the Pacific between Tuvalu and New Zealand and things like that. But this discussion needs to be more mainstreamed. And I think that's something we really need to push for. And this could be one of those spaces in which we kind of push this agenda. Although this workshop is coming at the end of the climate week, maybe,
But it's interesting also to think about to which extent the legal pathway on migration are incorporated in the response when we are dealing with. Of course, the first element is saving life. And that's the priority when there are disasters, etc. But this is an interesting entry point that we can further develop to start incorporating, legal pathway when we are responding. So to which extent in the contingency plan then are we dealing with more long-term solutions, because the current approach, we moved, right? But we don't think enough where we moved and how the movement can lead to more livelihood opportunity and not only temporary solution. This can be a new pathway that we, my also colleagues, Masako, we can bring it forward, something new. I want to, before closing, to give the floor to all of you just 30 seconds for the last message that you want to leave to this forum. Michael, are you still online?
I am here, yes, I am.
Okay, your last
Can you hear me?
word. Yes, we can hear you. Your last message, or recommendation, or reflection.
No, I would like to end the way I ended my participation in Kuwait a few weeks ago, a couple of weeks ago, and that is to say two things. First of all, I will echo what William said, also saying that heat exposure or working under extreme heat or other extreme phenomena is really it's a human experience, and for much that our expertise and the expertise of scientists and science in general is crucial to finding ways to mitigate that. I believe that we all, professionals and not, we all have to start from the human experience. That's why I said then in Kuwait that the next time everybody that lives around here in the Gulf, the next time we go out of our car to go into our building, let's linger 5 minutes outside and feel what people feel for 14 hours a day while toiling, while doing physically very demanding work. And the second thing is that there are different fora and different platforms where we all discuss, and we are all professionals and we have our contacts, us at the ILO, with WHO, IOM, other different organizations, civil society organizations. We have to come together and we have to have permanent platforms, not only of collaboration, but also of operational collaboration. We have to combine efforts, in other words, especially us that are fortunate enough to work with governments in the region and any other that is working with governments around the world. We have to convince them that they must come together and combine their efforts together with exchanging experiences and knowledge. That is from me. Thank you very much.
Thank you, Michael. William, your last word today.
Look, I think we are in a world of increasing mobility, whether it is climate, conflict, or work. More and more people are moving. I don't think the discussions on mobility has matured within the climate discourse. I think we need to see more of that, because at the end, whether it is resilience, adaptation, this has to happen in community. And communities that are moving will have to be involved in this discussions kind of thing. So I think the more we start focusing on, at least we start bringing up migration and it links to climate change kind of thing, I think the more we'll get a sense of how to strengthen adaptation and resilience strategies as well. Because, for example, migrants who are here, what is being done here, when they go back, some of those learnings they can take back with them. There is knowledge that is taken back as well. So I think this might be a strength to explore.
Thank you. Dr. Hossam, your last recommendation from this panel. Dr. Hossam, are you still with us? Let's maybe go back to Dr. Hossam later. Dr. Ahmed.
Okay, first I would like to thank, and then I would like to add my recommendation. First, thanks for the IOM for having youth programs and engaging the youth in into the migration processes. There is actually there is a program called IOM Youth Ambassadors, which is try to engaging the youth from all across actually the globe to be the change into the migration policies, which is great to engage and having the youth perspective with the member states. Also, I would like to send a special thanks into the IOM New York office, especially the youth focal point, Miss Amira, for always try to engaging the youth up there in the UNHQ processes and try to engaging them into the SDG summit, try to engaging them into the ECOSOC Youth Forum, the next one, and also into the Summit of the Future. All these meetings, it's so important to us as immigrants and as a youth and as a refugee. Also, finally, I would like to thank Eva from the Secretariat team for supporting me a lot in this MENA Climate Week. And recognizing, my final word is to recognizing climate refugee rights. We are demanding the real commitments and also implementation about the Human Rights Declaration and into the Paris Agreement. That's it.
Thank you. And big thanks from all of us, Eva, also for your fantastic coordination and assistance indeed. Thanks to have mentioned. Thank you, Eva. To close this session, I have a few points that to wrap up all our discussion, and then I will give the floor for Masako for the final closure. Basically, in conclusion, the environmental dimension in the context of human mobility add a complexity of the health systems itself. Its resilience in the form of adaptation, we had said. But it requires strong leadership and solid evidence informed to guide policy. Another point is the complexity of all the discussion we had, the climate change impacts and his associated effect on health, especially for work and migrants, call for collaborative approach, interdisciplinary and systematic action, collective action from all of them, from all the wide range of stakeholders. We have seen also from this panel how is important discussion from the different perspectives. Regular updates on data and information, and also enhancing more data in specific area, but also information on preparedness response plan, contingency plan for climate adaptation, but also how we can ensure human mobility is included in all adaptation plan of the climate change and relevant portfolio. Community attention, what they call it, and how we can more include the community. So increasing awareness on the health risk at community level and the measures that can prevent disability and mortality through the community, but also workplace intervention. I think we should always combine the two elements. No one can go and stand there alone. That's why the partnership with ILO, Migrants Forum, and IOM need to be stronger. And we need to engage community leaders, and of course the employer, which are the responsible of setting up the standard, looking at accommodation as we discussed. Early detection and timely access to preventive care. I am a public health. I insist on this point, how is important. We need to do more on insurance, the right to access, but also to increase at community level risk perception and willingness to access services at early symptoms. Usually migrants, they access where are in the late stage of the problem, and sometimes it's too late, and they will bring the disability back when they return. But we can prevent, insist on prevention. The whole route approach, we need to consider also where the migrants are coming from, dialogue with the countries of origin, and elaborate the risk factor and pre-existing condition that they may have, including trauma, psychological condition, but also the health profile, etc. So more dialogue between the countries, also origin, transit, and destination. And that's my last point. I wonder if we can identify some of the countries in the region to become a champion in advancing this agenda: health, climate change, and human mobility. There is a good potentiality. I've seen many progress that countries they are doing to protect also the health, also the migrant worker. Maybe we can have a champion countries to open the path. So I'm closing here with some thoughts and reflection. Of course, that's the beginning, and we will continue. And really a special thanks to all the panelists for the interesting, informative also discussion. Thank you. And over to you, Masako, to close.
Thank you so much, my colleague Michela, and again, all the speakers and panelists. I think my colleague Michela has summarized very well this, the main discussion points of this event. So I just want to thank everyone for being with us on this final day of the MENA Climate Week with this session. And also would like to thank the WHO colleagues. Many of them will not be able to be here, but they really supported us in terms of collaborated with us for the preparation. And of course, the UNFCCC colleagues, Eva and Joy, and all the team that supported for the preparation, and ICT colleague, technician in the background, and also interpreters. So I would like to just thank for everyone, and thank you so much, and have a good day.
Thank you, Masako.
Thank you so much.
Yeah.